About 8 million Americans have a problem called PAD, or peripheral artery disease. It's similar to coronary artery disease. Fatty plaque builds up in the arteries that carry blood to the head, stomach, arms, and legs. Restricted blood flow can lead to serious problems. Doug Johnson has details.
For James Johnston, getting around was getting to be a real problem several years ago.
Well, I could hardly walk, and I had a real pain in my hips and my legs. And if I walked on an incline, it was worse. And the faster I walked, the worse it got.
Finding a solution to the pain was difficult because it took a while to figure out what was causing it.
And this went on for, for 3 or 4 years because I thought the cause was my back, because I had back surgery 12 years ago. But that wasn't the problem.
The problem was PAD, something that affects millions of people. PAD is short for peripheral artery or peripheral arterial disease. Plaque deposits harden and limit how much blood can get to those parts of the body.
Generally, peripheral arterial disease is the same type of issue in the legs as you get in other parts of the body, like the heart. So the same type risk factors for heart disease will give you the same type of picture for getting peripheral arterial disease.
Plaque buildup, also called atherosclerosis, can have a number of causes. Smoking is one. Johnston was a smoker for years. High cholesterol from fatty diets, being overweight, and lack of activity can also contribute to the condition. Symptoms may be mild or cause so much blockage the results can be drastic.
But it can go from everywhere from asymptomatic PAD all the way to people that have threatened limbs that may lose their limbs.
Even when symptoms are mild, PAD can be a warning sign of the potential for other problems caused by plaque buildup, including heart attack or stroke. Sometimes exercise can help the body redirect blood flow past blocked arteries.
The patients themselves can develop a walking program where they will walk until the legs start to cramp. They walk a little bit further. There's medications we can give them, and then they can actually build their own collateral vessels, and sometimes we don't have to do any kind of procedures.
When procedures are necessary, doctors use CAT scans to track dye injected into the arteries to make a 3D map of blockages. Doctors use balloon angioplasty and catheters to remove plaque, and then install flexible metal stents to keep arteries open. That's what was used for Johnston.
He went in and he cleaned them out, and he put stents in both my femoral arteries in the left and right leg.
You can see the dramatic difference in one of Johnston's arteries after his procedure. He says the difference in how he felt was just as dramatic.
The next day I was back to where I was normal. No pain, no nothing. It was magic.
The use of stents may not be a permanent fix. Sometimes arteries may close again, requiring additional treatment.
There is a risk of reblockage. In the legs particularly, they're subject to forces of torsion and strain, so we do tend to see a higher risk, sometimes up to 50% within a couple of years.
Which is why it's important for PAD patients to stay active after treatment. For Smart Medicine, I'm Doug Johnson.